Hi everyone, welcome to this video on necropsy, a self-directed learning topic for PAHD. This is also the last topic for this subject. In this video, we were exploring the concept and process of performing a necropsy. It's a vital procedure for identifying the cause of death in animals. This video will help you understand the importance of necropsy in diagnosing disease, conducting research, and ensuring public health. By the end, you will also be familiar with how to differentiate between lesions and post-mortem changes, and how to properly collect tissue sample for analysis. Before we begin, let's review the learning objectives for this video. By the end of this session, you should be able to explain the concept of necropsy and its purpose, describe the step-by-step process involved in necropsy, identify and categorize lesions found during necropsy, distinguish between lesion and post-mortem changes, and lastly, explain how to properly collect tissue samples for further processing. These outcomes will guide our exploration into the necropsy procedures and its role in veterinary practice. So what exactly is a necropsy? Similar to an autopsy in human medicine, a necropsy involves a thorough examination of an animal body after death to determine the cause of death or to study disease process. This process involves detailed analysis of the tissues, organ, and bodily fluid to uncover abnormalities, injury, or disease. Necropsies play a critical role in veterinary medicine for diagnosis, research, and public health, particularly in identifying zoonotic disease that can be transmitted from animals to humans. The purpose of necropsy can vary based on the situation. It is commonly used for diagnosis to determine the specific cause of death or disease. In research, necropsies help scientists study disease mechanisms or test new treatment. Necropsies can also help an essential role in public health, particularly in identifying zoonotic disease. Finally, in legal and insurance case, necropsies can establish the cause of death, especially when questions of animal welfare or insurance claim arise. There are several steps to follow in the necropsy process, starting from the pre-necropsy phase through to the post-necropsy cleanup. These steps ensure that the procedure is carried out systematically and safely. We will go through each of these steps in detail, from pre-necropsy preparation to specimen collections, transportations, and post-procedures cleanup. First, let's discuss the pre-necropsy phase for group animals such as fish, poultry, or sheltered animals like dogs and cats. At this stage, it is important to gather the history of the animal and examine any live animals to collect relevant specimens based on suspected disease. Select animals in various stages of disease to provide the best opportunity for post-mortem examination, which will help in understanding disease progression. For individual animals like pets, the pre-necropsy phase involves gathering the animal medical history and conducting an examination if the animal is still alive. Avoid making preconceived diagnoses, as this can bias the necropsy findings. Always keep in mind protocol for preventing the spread of contagious disease when handling animals during this stage. Proper preparation is key for a successful necropsy. You will need to prepare your PPE like your lab coat, gloves, goggles, and masks when working in the lab. Pre-label specimen containers with a permanent ink to avoid confusion. You also need the right instrument for the job, a scissors, scalpel, blade, forceps, even bone cutters, to name a few. Lastly, make sure you have enough fixative, like 10% buffer formalin, for preserving tissue samples. During necropsy, you will collect various tissue and fluid for microbiological testing. It's important to collect this specimen aseptically to avoid contamination. Transport them as quickly as possible to the lab using ice pack or refrigeration if needed to preserve the sample until analysis can be performed. Now we move on to the necropsy procedure itself. Always start with the external examination of the animal body to note any visible injury or abnormalities. Follow specific protocol. For example, ruminants are placed on the left side and wild horses are placed on the right. Be sure to note the relative positions of the organs within the body cavities before proceeding with the internal examination. As you examine the animal with the vet, you may have tasks to collect any abnormal fluid or tissue you find. These samples should be taken aseptically and should include not just the lesion, but also some adjacent normal tissue for comparison. For best result, use 10% buffered formalin to preserve the tissue for histological examination. Examine the organs in the thoracic cavity first, before moving on to the abdominal cavity. Once the necropsy is complete, proper disposal and cleanup are essential. Place the carcass and organs in biohazard bag for disposal. Clean and disinfect all work surface and tools thoroughly. Finally, document your findings in detail for later analysis and records. Lesions are defined as abnormal change in tissue structure or function, often caused by disease, injury, or infection. This change can be subtle or dramatic, and recognize the characteristics of lesion is crucial for accurate diagnosis and treatment. Understanding lesion is vital not only in veterinary practice, but also in our human medicine. When assessing a lesion, several characteristics should be considered. First, the size of the lesion, whether it's microscopic or large, can indicate the severity of the conditions. Second, the shape can provide diagnostic clues. For example, circular lesion might suggest a parasitic infection, while irregular shaped lesion could indicate a trauma or cancer. Color is another important characteristic. Color of a lesion can tell us about the underlying process. For example, red lesion might indicate inflammation of hemorrhage, while pale or white lesions suggested reduced blood flow or tissue necrosis. Yellow could point to fat accumulation or pus, while black might be a sign of tissue necrosis or melanin deposits. Lesions also vary in consistency and texture. Soft lesions are often associated with inflammation or edema, while firm lesions may suggest fibrosis or solid tumors. Fluid-filled lesions might indicate cysts or abscess, and gritty or hard lesions can result from calcification. Lesions can appear on the skin or inside the body, affecting specific organs or tissue. The location of a lesion can provide diagnostic clues like skin lesion indicating dermatitis, lung lesion suggesting pneumonia. Additionally, the distribution of lesion, whether it's focal, multifocal, or diffuse, helps to narrow down the potential cause. The borders of lesion can also offer important information. Well-defined edges usually point to benign conditions, while poorly defined edges might suggest malignancy. The surface features of lesion, whether it's raised, flat, or ulcerated, can also provide clues to the severity and stages of the disease. If a lesion contains fluid or pus, analyze its content can give us further diagnostic information. For example, serous fluid is clear and indicate mild inflammation, while pus often point to bacterial infection. Hemorrhage lesion filled with blood may indicate trauma or cancer. In some cases, lesions emit distinct odors, which can also be a sign of infections or necrosis. Now, let's move on to the process of sample collection for histological examination. When selecting tissue samples, it's important to identify the area of interest. Samples should not be more than 1 cm thick to ensure proper fixation. Be sure to collect both abnormal and adjacent normal tissue to provide a full picture of analysis. Once the tissue sample is collected, the next step is fixation. Fixation preserves the tissue structure and prevents degradation. And the most common use is the fixative 10% buffered formalin, which stabilizes the tissue by cross-linking the proteins. Proper fixation is essential for high-quality histological section. Other than formalin, we also can use glutaraldehyde, which is commonly used for EM, which has more detailed preservation of ultrastructure of the tissue. The fixation time usually takes about 12 to 24 hours. Labeling and documentation are critical parts of the process. Clearly label the specimen container with all the relevant information, such as the patient name, specimen type, and the date of collection. Along with proper labeling, you will need to document clinical history and the reason for collecting the tissue to ensure accurate diagnostic outcomes. To summarize, necropsy is an important procedure for understanding the cause of death and studying disease process in animals. It involves a detailed examination of both the external and internal tissues.